Hello, everybody. Thank you for joining us for our virtual information session on the MSN program in public health and school health. Thank you for taking time out of your day. I know as it stays light a little bit longer, it's tougher to give up your evening time. And so again, thank you for your attendance here. And whether you're watching the live part or you are watching the recording, we look forward to working with everybody in the future. But before we go any further, Dr. Barrett, would you mind introducing yourself?
Sure. I am Dr. Barrett. I teach primarily in the graduate program. Public health is my thing. It has been for over 30 years. So it comes naturally to me, and I love it, and I get excited when I get to talk about it. So yeah, graduate program. I did teach. Been here at Bloomsburg University for this is year 7. So spent the last pretty much 6 years undergraduate public health nursing, and have now segued into the graduate program. So excited to talk about it.
And prior to entering academia or the professing business, what were you a nurse?
I have been a nurse for over 30 years. Like kind of gives away my age a little bit.
Yeah.
But yeah, I have worked in public schools, worked in the school setting, been a school nurse for still substitute as a school nurse, doing that next week actually.
Nice.
So I still love doing that and go back and help out those nurses because it is hard to find substitutes. So also worked in home health again, which is part of we're going to talk about job opportunities. So that's another one. And have worked in occupational health and university health services, but a long time ago in the hospital. So have done a lot of the community health based jobs that we're talking about. So
excellent. So basically, if it's a public health job, basically, or you've done it. It sounds like you've kind of run the full gamut.
Yeah, kind of close. Yeah.
And my name is Tom Kresh. I'm the director of graduate admissions. So thank you, everybody. The event should take maybe 30 or 40 minutes. This is being recorded, like I had mentioned earlier. But if anybody has any questions, please do not hesitate to ask. We work for you, and we're happy to do so. But I'm going to go ahead and share my screen. I know Dr. Bear has a great presentation lined up here. Go nice spring photos. We look forward to some warmer days. It's been in the 50s in Bloomsburg, so it's kind of warming up just. Sorry about that. I thought I was going to the next screen. All right. So Dr. Bear, why the MSN in public health? What, at its most basic level, why would a person want to go into this program? Why would they want to go into this field?
Oh, that's a loaded question. I'm going to try to keep it keep rambling on. I don't want to sound like I'm doing a lecture here, but basically I think it's a great opportunity to care for and manage the health of populations. Public health is really focused on upstream measures of health promotion and health prevention. And we'll talk about this a little bit later, but there are so many different, there's such a diversity in places that you can work as, with a public health degree. And the master's levels work that we offer, gives you that accessibility, that mobility to move into, leadership and management positions at at that population health level. So that is, in a nutshell, that's basically why there are benefits for, like we're going to talk about school nurses in particular, and Department of Health work is another one, epidemiology, corrections, lots of opportunities out there. So you can, care for diverse populations and, gain experience in leadership and management as well from this.
So is it safe to say, Dr. Barrett, then that in order to go into any of those fields, that basically the minimum entry requirement is a master's degree? So like basically without the advanced degree, some of those other careers are not going to be unlocked.
Correct. Now you can, some of these areas you can work with your bachelor's degree and move, while you're working, obtain the master's degree. But if you're looking at Department of Health positions where you're, working in epidemiology, or even in an acute care setting where you're, planning, disaster preparedness kind of programs,
Right.
yes, it would be preferable to have a master's degree. And I also have a student right now who is, she's a case manager, does telehealth management for an insurance company, for a private health
Mhm.
insurer. So she joined the program because she was told, and she feels that it will be beneficial for her movement in that setting.
Sure.
So,
Great, great.
okay.
Could you just walk us through some of the program from a high level overview? What are some of the key highlights that someone might be interested if they're considering a program like this?
Sure. First of all, as you can see, I'll go hit the high points that are here on the slide, but we do have the traditional public health track, and then we also have a school health nursing track, which is tailored to meet some of the special needs of our certified school nurses here in Pennsylvania. We do work on a case by case with students who may be from outside of Pennsylvania, because this master's degree is not a licensing. You don't end with sitting for a licensing exam. So we can, on a case by case, we figure it out. We have people that help with that will do the research for us. So we could take students from out of state, but we do have those two tracks, the traditional public health, and then a track tailored for school nurses, which we'll get into the details of that in a few minutes. The program is 100% online. We do have a culminating clinical course. There's a clinical practicum, and we'll talk more about that, but that can be done in your local community. And we work with you on, who you do that with, and we'll talk more about that. But everything leading up until the final 1 or 2 clinical courses that you take, everything is online, can be done primarily asynchronous, which means that the courses that you don't have to show up on Tuesday night from 7 to 9 for class, that, your professors are available to you. I have to say, we have to have office hours, but availability of your professors is something that I think is a very, very strong point for this program, is that if you, we understand that our students are working, most of it, working, have families, and then they're heading back to school. So if we need to talk at 5 o'clock in the morning, we'll do that. If we need to talk at 10 o'clock at night after the kids are in bed, we do that. But and you also have the ability to move, like, as we mentioned, directly from your BSN into starting these MSN courses. And additionally, you can work at a full-time schedule pace with courses, taking more or less 2 classes at a time, or we have part-time options. So we have people, I have a student who just had a baby 4 days ago. So we're working with her to give her a little bit of time to, obviously get settled with the baby. But we have people that take a semester off here and there. So we work with you.
So Dr. Barrett, are a majority of your students, are they currently working full-time as nurses?
Yes.
Okay.
I believe they all are, that I'm aware of. Yes. And yes, especially in the public health master's program. I teach students from some of the other tracks as well. But pretty much everybody is working full-time, has families, and busy people.
Sure.
People.
Yep, absolutely. And it looks like here again, a lot of the courses there, I mean, basically the whole program is built for working nurses in mind.
Right.
So that's great to hear. And so when you say full-time and part-time options, the breakdown would be what? So I guess your typical part-time student would take 3 credits, which is 1 class per semester. Are they generally taking 2, or what? Do you have any idea like what a normal student might be doing?
Generally, full-time students are not taking more than 2 classes per semester. So we have students that can take more classes over the summer, for example, or over the winter session. Sometimes we will offer classes. So typically I have students that if you're not in a big hurry to get this done, they'll do 1 class at a time, and we just plug away at doing that. And that's fine. That works.
Right.
That works.
And the classes are offered, fall semester, spring semester, and summer. So basically year round.
Yes. Sure. And if we need to, I just this last winter, I did do one of my school health classes over winter break, because that's what worked for my group of students. So we set it up and we did that. because it worked for them.
Right. Oh, that's great. That's great to hear. And that gets us into one of the two specializations. So one of them is the public health specialization. Could you walk us through the program, some of the details and what students might expect if they're in this field?
Absolutely. So basically, this public health nursing specialization is our traditional track, if you want to call it that. It's our school nurses. If you're a school nurse and you want to take this track, your specialization, you can do that. And I've had school nurses that want to do that. They want to do something a little bit different, so they do this. But if you are, again, looking to go into some of those other areas that we mentioned, here's basically what it looks like. Again, the focus is on population health promotion prevention, so care of populations versus care of those individuals, which we're typically accustomed to in an acute care setting, such as a hospital. We do have core courses, and there are 12 credits of those. I believe our next screen will show you exactly what they are, but we start out with anybody who's in a graduate program basically takes that theory course, which is 501, epidemiology, which again is a great course for the public health students to have, and basis of research. We all love research, so that's a core course for everyone. Community assessment and family theory. So those are your core courses that everybody will see. When we talk about the school health track, we're going to see those again pop up there. So yeah, and then for the public health, we do have transcultural health, which is a little different than some of the other MSN tracks, which is very useful. Again, when you're caring for diverse populations, we need to consider culture. Culture is something that we need to pay attention to. And then from here, we move on into some specialized courses that are meant to help you as you move forward in public and population health. So we have management helps us out with a couple courses with leadership and managing people, which is a big part of what needs to happen when you're moving through this program. And then your last two courses are there, 511 and 531. Those are the practicum courses, and you can see they really do get into pretty intensive into public health and population health. And there are projects involved with that. We do some scholarly writing, but you'll see the practicum on there again, which is done in your community.
Right.
You can reach out to who your preceptor might be for that, and so then and you schedule those hours when it works for you and your preceptor. So very flexible there. Total 39 credits. There's an elective that you could take as well.
So conceivably, basically you would be able to do your practicums wherever you're living. So if you live in Western Pennsylvania or you live in the South Florida, conceivably you could do your practicum there. Okay.
Yes,
excellent.
Absolutely.
And that gets us to school health.
Okay. So the school health nursing specialization is really for our certified school nurses. So in Pennsylvania, we do school nurses are certified. Not all states are like that. That's not a requirement across the nation. So Pennsylvania, we're lucky, actually very lucky to have this. Have to have certified school nurses in your schools. So the course is just this is a little bit different. Just some benefits are obviously that if you're familiar with working in the schools, whether you're a teacher or a social worker or a guidance counselor, whatever you do, Act 48 hours are important, and whoever out there is working in the schools know the language that I'm speaking there. So of course your credits can be used to meet those Act 48 hour requirements. And also, if you're seeking a level 2 certificate as a school nurse, a permanent certificate, this is a great way to make that happen. So those are just some pluses for our school nurses. The core courses here are 18 credits. We have, and you'll see those same initial courses on there, and up until transport. Yeah. And so then we'll move into, there's a school nurse theory course and a school nurse educator course that are a little bit different, and they're tailored for our school nurses. So those are two courses that are a little bit different. And instead of the 2 clinical courses to finish, because these nurses have already gone back and have probably 15 or 20 graduate credits already from their certification program. They take one practicum course at the end, the health promotion with populations.
So the clinical courses altogether are about 180 hours. So the 180 hours, how much time do you have to complete that amount of I guess, clinical hours?
Typically, we offer those over the summer. So you have 12 weeks to make that happen. And I have, and again, flexibility with that is the buzzword with us. I've had students who get it all done, in the first 4 to 6 weeks of summer. They go full time and they get that done. And then I have others who wait until end of summer to make that happen. I've also done it with students in spring or whatever works out. We'll do that, but typically summer is when we do those.
Great.
Typically.
Yeah.
Okay.
All right, that gets us to the coursework then.
Yeah. So again, I do need to point out here with the school health track that there is pathophys and pharmacology thrown in there. That's we say you don't have to take that 511 practicum course, but we get those credits in there another way, and that's with having you take patho and pharm. So and the school nurse courses. So those are the primary differences between the two tracks.
Sure. Okay. So, and actually, this is kind of one of my questions then. So if you're someone who's interested in this field and you're kind of torn between going into public health or school health, what are some of the key indicators that might help guide someone's decision into the right track?
You mean between the public health and the school health track, or
yes.
any other? Okay.
Really, between public health and school health.
Yes. Well, the school health is tailored for our certified school nurses. So you would need to be a certified school nurse to take part in that program.
Right.
If again, the traditional public health could be, you want to work in any number of these areas, this degree really would be helpful. And as I've said, I've had school nurses who really are looking to move into maybe some of these other areas, or move into a leadership program, or leadership position. So they will opt not for the school health program. They want to do the traditional public health. So we've got flexibility there. So again, health department, public health jobs are out there. I actually looked at that earlier before we came on, just to see what's out there, and they do have jobs posted for epidemiology. They do really, one of the requirements is that you do have a master's degree or higher in public health. Right. So this would definitely be helpful with that. And examples, I did have one of my students spend time with a nurse that does disaster preparedness in a hospital setting. So it's not all, community-based settings. Right. If there are jobs within a hospital where you're working with community agencies, right. There's opportunity there. And disaster preparedness and epidemiology are two areas, even within a hospital setting. If that's where you're working, this type of work could, in a master's in public health could really come in handy there.
Right.
I just want to hit on Veterans Administration yet. That's something that we sometimes, I think, is overlooked.
For sure.
But that's a very, very valuable, area, a population that, could use some specialization in, their needs are a little bit different oftentimes than our general population. So a degree in public health would definitely be valuable there. And correctional facilities, I do have to put in my pitch for corrections, because that also is another, another area where populations might be overlooked in there. It's not as common to hear that nurses are working there. Right. But you have opportunities there with the state system. Again, that's the same system essentially that your public health departments are in, They all worked under that same umbrella of, human services. So you've got state correctional facilities, and I would not want to let out the federal facilities. I did have an opportunity to take my students to the federal penitentiary in Lewisburg, and that's their nurses work for the Department of Corrections at a federal level. So that opens you up to mobility, going to any facility in the nation. So if you're in that federal system, that's valuable. And they also hire nurses under the Public Health Service, which is a federal, health organization that's been around. It was one of the first public health agencies in the nation. So they also hire federal level nurses for those positions.
And what you see here too are a lot of organizations that are, I mean, they're making a tremendous difference too, especially when we're just coming out of a pandemic, right? So things like epidemiology and, with all, we've had to, unfortunately, just, there's been some natural disasters. So, working in disaster preparedness and all of these are such high need areas too. And so our graduates are going to be uniquely prepared to be able to help really impact a lot of people's lives. And correct me if I'm wrong, Dr. Bear, it seems like a lot of these are jobs to a certain degree where you're looking at the big picture. It's not necessarily working with an individual patient. It's looking at like, all right, how are we going to affect the health and safety of hundreds, thousands, tens of thousands of patients? Is that accurate?
Oh, absolutely. You nailed it. That's the key. And if you look at, any of these, things that we've talked about, that's your goal. That is to, whether you're doing surveillance for, with the pandemic, I can tell you that nurses in schools, occupational health, taking care of employees, that's also, caring for that entire population within your organization was an issue. And I'll tell you what, the nurses that were active during the pandemic in these settings, they were quick studies on epidemiology. If they weren't familiar with it, they became so very quickly. So yeah, definitely important stuff there. And one more thing that I did want to point out also that we might have missed is higher education. I have several, I should say, that I know probably, a handful of students, including myself, who went through this program. And we have 2 adjunct instructors right now who are teaching. They're working in higher education. They're teaching in nursing programs, and they're teaching in public health. So that's also an option too. It opens you up to that profession as well, which I think is.
Well, and Dr. Bear, I'm sorry to put you on the spot here, but what are some examples of what our alumni are doing? So you mentioned higher education. Can you give any other examples of some of the career directions that our alumni have gone into?
I did. Yeah, I have a student who was in a hospital setting and did come back and then completed the master's program. And she did move on into a management position within an outpatient clinic setting. So she was managing populations from a clinic setting point of view. So that was helpful for her. It did really help her move into that position that she was ready to move into. And I have school nurses who have moved into leadership positions within the school setting. Most school districts, especially bigger school districts, have nurses who manage the school nurses and those populations.
Okay.
Yeah. So and corrections too. We've had some nurses who, again, moved into leadership positions within the correctional setting.
Yeah, that's great. It is, absolutely. Yeah, that's very interesting. And that kind of gets us into the program cost. And this is one of the questions we get pretty frequently is how much does the program cost? And so what I have up here, just the cost, and this is per course, right? So if you were going to take 2 courses, you just multiply that times 2. And obviously all these details are available, not only on the university website, but on the MSN Public Health website as well. then you see the Pennsylvania resident cost as well as the non-Pennsylvania resident. So one of the benefits of Bloomsburg too is basically the value you're getting in your education, whether you're an in-state student or non-Pennsylvania resident, you're going to get tremendous value in education, which makes your investment in your degree that much better. And I would imagine that oftentimes too, major hospital networks too, they're going to have some type of tuition reimbursement. So when you couple that, with the ROI, the fact that the program itself is built for people who are working full time, and it's easy to kind of upskill, not easy, but it's possible to upskill. It makes it a good opportunity. So that's good to know. And then we move into the application and admission process. Dr. Bear, for anyone who's interested, what do they need to submit? What are you looking for in a competitive applicant? Can you walk us through the process?
Okay. Well, obviously we would need to see your college transcripts and see how your performance has been in past work, and see if there's any areas where you're excelling, where you might need to brush up on some maybe scholarly writing or public speaking. We do that. A lot of those things that we may not have enjoyed so much in undergraduate, but we do take that to another level, because you are, working on program development. You're the leaders now, you're taking on more of an advanced practice role. We obviously would need a current nursing license. We would need to see that's active. Career goals, we would talk with you about, why are you doing this? What is your motivation for coming back to school? And, and talk about, how this fits into your short-term and your long-term goals. So we do an interview, and, with each person, with each applicant, and talk about clinical experience, where you've been, where we are today, and where we're headed for the future. So.
And Dr. Baird, and again, students can start fall, spring, summer semester, right? Basically any time of the year.
Right. We have rolling admission. If it works for you, if you're interested, in gathering more information now, we could have you start this summer. If anyone were interested, again, any semester, we could have you come in.
Sure. And then this is our contact information. Like I mentioned earlier, we work for you, and we're happy to do so. So if there's anything we can do to help, we're happy to do so. And call us, email us, stop in to see us. We're on campus, pretty frequently. We are really, really happy to help. So Dr. Bear, did you have any parting advice, any final recommendations for anyone who is watching?
I would say if you have any interest in in population health, that upstream health promotion approach, that's where we're coming from. And that traditional medical model is that we wait until things are broken, then we try to fix them. So this is just something I feel strongly about. And so if you want to learn more, we can certainly talk. I'm always open to reaching out and sharing as much as I can to make this possible, if it's what you're interested in.
So, and I'm sorry, can you just back up just a little bit? So this, the traditional model of, being kind of reactive in, it seems like public health is more about preventative measures. And for anyone who's watching is like, yeah, of course that's the case. Sorry if that's just kind of clicked in my mind, and in case I'm not the only one. So again, this is kind of looking, it's kind of zooming out to 10,000 feet, trying to, prevent some of these things from happening to begin with, looking at trends. And it really is an interesting field. It's a very unique segment of nursing, and probably one that people might not think of in the most amount of frequency. I mean, when you see a TV show or a movie or a picture of a nurse, normally it's nurse in patient care. It's very traditional. This is more of people in leadership roles and again, trying to work to save larger groups of people.
Absolutely. And again, I don't want to lecture you, but yeah, those principles of public health nursing are assessment, assurance, and policy development. So those higher systems level things are the tools that really can impact the health of populations. And to come back to the pandemic, you know, that we have policies and regulations coming from the federal government down to the state, and they have an impact. They have a much broader impact. Policy and program implementation, you know, across communities obviously hits more than just, you know, the individual, but has an, you know, impact on the individual, family, and community. So it's really that health promotion and prevention, you know, caring for people where they live, you know, work and play. So it's getting out, you know, getting out of that traditional setting and mindset that we might be accustomed to.
And I'm sorry, and I have one more follow-up question. So we had a slide that we talked about job outlook and some of the career options. What is the demand? Are those branches or those segments of nursing, are they expected to be in somewhat high demand next decade or so? Like what can people expect the job market to look like?
Oh, absolutely. And you know, if we, you know, when we're thinking back to, you know, that if you look back at that slide, home health, Department of Health is always looking for people. Corrections, as I said, we take students out in our clinical right now, and they're giving us tours, and they're, you know, they're touting the benefits, and they're actually looking for people. So yes, the demand is definitely out there for educators. If you want to teach, whether it's in academia or in you know, in
a hospital setting,
indoor setting where you're doing staff development and education, definitely lots of demand in some of the areas. And the benefits too are, you know, are out there. If you're looking at if those state level jobs, you know, the benefits are something.
Well, again, and a lot of organizations that were up there as you know, where people might be employed by state, federal jobs. So you're looking at pay that's going to be very good, and benefits is probably going to be even better. So that's, you know, that's the compensation packages for positions in these fields, I would imagine, is going to be pretty lucrative.
Yes. Well, yes. And sometimes this get, you know, going from a hospital, I've worked in the hospital, worked my holidays, worked my nights and weekends. You know, some of these jobs might afford you, you know, just being practical about it. They can afford you, you know, maybe a better lifestyle if you do have a family, you know, better schedule, and benefits and all of those things. So yeah, there are benefits as well in that regard. Definitely.
Yeah, that's a great thing to point out too. I mean, that's really important. I mean, you know, there's you know, people working in healthcare. I mean, there's a lot of hours, a lot of non-traditional hours as well. So this is one of the few options out there where the hours might be a little more traditional. So that's good to know. Well, thank you, Dr. Bear. I really appreciate it. For anybody who is, again, watching live or watching the recording, we appreciate your time. Please do not hesitate to reach out to us. We are happy to help, and hope you have a great night.
Thank you.